So we're going to go ahead and we're going to move on to Kelly Pines. She's Clinical Director at Home Rehab. So Kelly, let's talk first about the many things that your company does, because according to your website, I mean, there was just a ton. I was really surprised at the variety of things that you guys handle.
Yes, our name doesn't always give it away, right? So we provide home care services in your home, wherever it is that you live, whether that's in a house, a condo, do you live at an assisted living facility? We can come to wherever you're living or staying, and we provide nurses, physical therapy, occupational therapy, speech therapy, and a social worker. So all of those things are a benefit that anybody who has a Medicare or a managed Medicare has this as an option for them. It's often called home care, and oftentimes people will hear the word home care and they think this is someone that comes to my house and helps clean it. We don't do that necessarily. I would like one of those people to come to my house too, but we don't do that type of home care. We provide the medical care and rehabilitation in the home.
So who qualifies for your services, and is it generally covered by insurance? So is it really anyone who needs physical therapy, or are there people that must be eligible to receive it in their home versus having to travel out to a doctor's office?
Great question, and this is a question a lot of people ask. So there is a criteria, and the criteria is a very gray answer. We always want it to be a black or white answer, and it isn't. It's very gray. So in order to qualify for someone to come to your home, there has to be a physician, your doctor has to say, we need someone to come to you. It also has to be challenging for you to leave your home. And challenging is a defined word that is defined for each individual. So it may be challenging for one person just to go up and down steps to exit or enter their home. That would qualify them. It may be very challenging for a variety of different cognition issues. It may be very overwhelming for someone with dementia to leave the home and go to a very busy clinic. It also could be that you have a respiratory disease concern. You're at risk for something. You're undergoing chemotherapy and you are not able to go out into the public as safely as you once could. That would qualify you. So there's no magic answer. Everyone that has Medicare or a managed Medicare has this benefit, and most Medicare and Medicare Advantage plans cover it 100%, which is very different than going to an outpatient therapy center. That's a different part of your insurance that you use. Having it in the home is a very different part. So they operate very different from each other. So if you look at your plan and you see, I'm gonna look up what does physical therapy gonna cost me? That is not the type of services that we have. That's going to a center and getting those services at a center. When we come to you, it's very similar. It's a different thing. That is called your home healthcare skilled benefit. So that's where you would find that within your insurance.
That gets pretty specific. So always good to have a person to ask questions. So one of the most challenging things that I see among seniors are the results that can happen from a fall. Tell me about how you guys screen seniors for their level of fall risk, and how do you work with them to both maintain their muscles and their balance that can help prevent a future fall?
This is a great question, because this is what I see every single day. I see people that are falling. They're either falling publicly and everyone knows they're falling, or they're secretly falling and not telling anyone that that's happening, or they're at risk of falling, all of which are very dangerous, as we all know. Show of hands, how many people know someone who's fallen and broken a hip? So when we look around the room, we see that is a very, very serious injury that comes from falling. And falling is one of those great things that can be prevented. So the things that we do to screen. So I actually specialize in fall prevention and balance dysfunctions and such. So I come in and look at a variety of different things. The first most obvious one we look at is, how is your home set up? What does that look like? Do you have enough room to get your walker into your bathroom? Maybe your doors are not wide enough. So we look at, do you have clutter? Do you have area rugs? Do you have things that could easily cause a fall from happening? So we do that. We look at all of those external things. Then we look at internal, because we get our balance from such a different variety, several different parts of our body, which is great because we get it from our eyes, we get it from our inner ear, we get it from our muscle strength, and so it is really quite interesting. You do have to have all of those things looked at by a balance specialist. So we have to look at all of that and how you're using your parts of your balance. Which ones are you using too much? Which ones aren't you using at all? Is there a reason for it? So sometimes there are diseases, like these other two lovely ladies have mentioned. There are different things that happen in disease processes that affect one or more parts of your balance. So we may have to say, okay, this part of your balance isn't very strong. We need to work on making the other parts of your balance even better.
Great. Yeah, that's huge, because one thing I also know is that once someone has a fall and breaks something, at a certain age, it's just so much harder to ever get back to that 100% level. So the more that we can do concentrating on prevention, absolutely the better. So how does your approach change when you have a client or a patient that is struggling with cognition issues?
Yes, that happens quite a lot, because oftentimes, depending on the cognition issue, so we'll just kind of throw out the diagnosis of dementia. Dementia is very different for each and every person with dementia, right? So depending on the person, are they able to learn new tasks? Just because you have a diagnosis of dementia doesn't mean you can't learn something new. We also have people that are unable to learn or retain things because of their dementia. So it depends on where that person falls on the cognition scale, and we do some testing to determine what your ability is to learn something new. But here's the cool thing, is even if you do not have the ability to learn a new task, or hey, I want to give you this walker to help you walk better, and we all know someone that has had dementia that is not going to use that. They're going to set it off to the side and walk without it. I see that every day. And that's okay, because we have the ability, our balance and how we respond to losing our balance is automatic for everyone, up until, everyone cognition-wise, up until the end stages of Alzheimer's. That's the only time your balance is no longer automatic. So even if you can't follow directions, or your loved one can't follow directions, we can still improve their balance by affecting their automatic balance. That gets very, very challenging and exciting sometimes during a session, but it can be done. I see it happen every single day. I work on it every single day. And if we can provide, just one person from avoiding one big fall, we got to go for it.
That's great. So what are some of the things that you guys do in your company for clients to help them remain healthy and independent in their homes, and really anything else that you'd like to add?
Yes, that is the ultimate goal. That's why we come to you. We want you to be able to stay wherever it is you want to stay. And most people want to stay in their own home. Just by having someone come into your home, oftentimes the information that I get is, I don't want you to send me somewhere else. I don't want to do that either. I want you to be successful in whatever environment you live in and want to be at. So we may have to recruit some other folks, right? So our company, do we have to have a nurse come out and make sure that you are taking your medications properly? Are you taking them like you're supposed to? Are you having side effects that might be affecting your balance? And so we have a nurse that can do all of that. She also is great, or she and he's, we have several nurses. They come out too, and they can help you with your disease processes. So, hey, I have diabetes, but I kind of don't know what that means, and I'm not entirely sure if I'm doing well with it. They'll help you come up with a diet plan, with a meal plan that accommodates all of these things. So they provide as much education and training on your medical conditions that you would possibly need. A lot of times that includes discussing medications. They go back and forth communicating with all of your doctors to say, hey, heart doctor, did you know that eye doctor prescribed this? And hey, did you know that this person gave their mom an additional couple doses of this because she had some extra at home? These things happen every day. People borrow medicines, people have medicines from 1971 in their cupboard still that they take on occasion. We see all kinds of exciting things happen, and let's say that keeps our nurses quite busy. But that alone, making sure you're managing your medications successfully and taking them successfully, ultimately can help you in every area of your health. Then our occupational therapists, what they do is very similar to what we just learned about earlier. Occupational therapy, oftentimes people hear the word occupation, and then they say, I'm not going back to work, I don't need you. And it is a little bit misleading, the name. Occupational therapy, what our team does is they come in and help make sure that you are remaining independent or becoming more independent in taking care of yourself, your home, your loved ones, your pets, whatever that looks like. So that's different for each and every person too. So for the person with very low vision, like we learned earlier, our therapists come out and help you be more successful with your vision ability. If we focus on what you can do and help you be more successful, then you're likely going to stay in your home longer and forever. We want you to do that and be safe from a variety of different reasons. So our occupational therapists will help with bathing ideas, cooking ideas. Hey, did you know that if you sit on a stool and make your dinner, you will conserve so much more energy that will allow you to continue to cook as opposed to not cooking. So even though that seems like such a simple thing, they are magicians at coming up with changing up the way people operate in their own homes so that you can be more successful. Our social worker, she is an option for folks in the fact that sometimes we do see people living in conditions that are not safe. And oftentimes we have to call on her to get some more help. So whether that means we need financial help, or do we need to find a waiver program or something that allows for some additional services? Does that mean, hey, this person is living alone and really they don't want to be living alone anymore? Do they need more help from individuals? So we have a social worker that can do that. We also have a speech therapy team. The speech therapy team helps with swallowing, voice projection, and cognition to a degree as well. So anybody that falls into those categories, speech therapy is for you. And then last but not least is my favorite, physical therapy. I mean, that's because that's what I do. But so obviously then what the physical therapy does is we come in and we're looking at balance, strength, motion, pain, all of those things that would help you be more successful to be and stay independent in your own home.
Great. I think so often we all just need sometimes a second set of eyes and a sounding board to, you know, talk about what's happening in our homes and have someone else go, oh, wait, you know, that might be why this is happening or not happening, and can be really helpful for that additional, you know, additional expert.